You do your best to take care of your health. You watch what you eat, you try to stay active, and you diligently check your blood pressure, trusting the numbers you get at home and at the doctor's office. But what if I told you that many of those numbers, the very numbers used to make important decisions about your health, could be wrong? It's a startling thought, isn't it? But simple, common mistakes made every day, both at home and even in the clinic, can make your blood pressure look higher than it really is. And we're not talking about a small change. These errors can inflate your reading by 10, 20, or even more points. That can be the difference between a perfectly healthy reading and a diagnosis of stage 2 hypertension. It's the difference between peace of mind and starting a new medication, sometimes for life. Today we're going to pull back the curtain on the 5 most common mistakes that might be fooling you, and maybe even your doctor. I'll show you exactly how these errors happen, the dramatic impact they have on your numbers, and most importantly, how to take a blood pressure reading correctly, every single time. By the end of this video, you'll be able to take charge of your numbers and make sure any conversation about your blood pressure is based on data you can trust. The first and probably the most common mistake happens before the cuff even starts to squeeze. It's all about your posture. Think about it. When you check your pressure at home, are you slumped on the couch with your legs crossed? At the doctor's office, are you sitting on a tall exam table with your feet dangling? These little things seem harmless, but they can seriously throw off your reading. Here's why. Your body is always adjusting. If your back isn't supported, your core muscles tighten up to hold you upright. And that little bit of work can raise your bottom number, your diastolic pressure, by about 6 points. If you cross your legs, you can add another 2 to 8 points to your top number. It's because crossing your legs squeezes blood vessels, and your heart has to pump harder. But the biggest mistake with posture involves your arm. Your arm has to be supported, with the cuff at the same level as your heart. If your arm is hanging down at your side, gravity will make the reading artificially high. And the impact is not small. An unsupported arm can raise your top number by 10 points or more, with some studies showing an increase as high as 20 to 23 points. Think of it this way. The machine is measuring pressure in the arm. If gravity is helping blood pool in that arm, the machine will read a higher pressure. On the flip side, if your arm is held up too high, the reading will be falsely low. So what's the right way to do it? It's simple, and you have to do it every time. Sit in a chair with your back straight and supported. Your feet should be flat on the floor, not crossed and not dangling. Your arm should be bare and resting on a flat surface like a table, so the cuff is about level with the middle of your chest. This ensures the reading is all about your heart's workload, without interference from muscle tension or gravity. Whether you're at home or in a clinic, you have a right to be in this position. It's the foundation of an accurate reading. The second big mistake is one millions of people make without realizing it, using the wrong-sized blood pressure cuff. Most machines you buy come with one regular cuff in the box, and busy clinics often grab that same one for everyone. But our arms aren't all the same size, and a bad fit can give you a completely wrong number. The bladder inside the cuff needs to squeeze the main artery in your upper arm evenly. The guidelines say the inflatable part of the cuff should wrap around about 80% of your arm. Here's what happens when it's the wrong size. If the cuff is too small for your arm, it can't press on the artery correctly. To get the job done and stop the blood flow, the machine has to pump up to a much higher pressure. This will make your reading look way higher than it is. How much higher? Using a regular cuff on someone who needs a large one can add about 5 points. But if that person actually needs an extra large cuff, it can overestimate their blood pressure by a shocking 20 points. On the other hand, if the cuff is too big for your arm, it will cut off the blood flow too easily, giving you an artificially low reading. This can be just as risky, because it could hide high blood pressure that needs treatment. So how do you fix this? You have to measure your arm. Take a flexible tape measure and wrap it around your bare upper arm, halfway between your shoulder and your elbow. Now look at the cuff itself. It has a range printed on it, usually in centimeters. Make sure your arm measurement falls within that range. If it doesn't, you need to buy a cuff that's the right size for you. This is something you just have to do for an accurate reading. As a final point here, the American Heart Association strongly recommends using an automatic cuff-style monitor that goes on your upper arm. Wrist and finger monitors are not recommended because they're just not as reliable. The arteries in your wrist are smaller and harder to get a good reading from. Stick to a properly sized upper arm cuff. Our third mistake feels so minor that almost everyone does it, especially in a chilly doctor's office. Measuring blood pressure over a sleeve. The nurse might say, "Oh, that's a thin shirt, it'll be fine." Or you just don't want to bother rolling up a sleeve at home. Please don't do this. It's a critical error. Taking a reading over any clothing, even a thin layer, can mess with your numbers in a big way. Studies show that measuring over a sleeve can raise your reading anywhere from 5 to 50 points. That's a huge range, and it all depends on the fabric. A thin shirt might add 10 points, but a thick sweater could add 40 or 50. You just never know. The problem is physics. The cuff is designed to press directly and evenly on your skin to squeeze the artery. When you put fabric in between, the pressure isn't even anymore. The cloth can bunch up and diffuse the force, meaning the machine has to inflate to a much higher pressure to do its job. It ends up measuring the pressure needed to squeeze your arm and your sleeve, and it can't tell the difference. Let's try a quick thought experiment. I take my reading over my sweatshirt and it comes back 142/88. That's stage 1 hypertension. Now I take the sweatshirt off, wait a minute, and do it the right way with the cuff on my bare arm. This time it's 124/78. That's an elevated reading, but it's not hypertension. Same person, same arm, same machine, minutes apart. The only difference was a layer of fabric, and it was the difference between a diagnosis and a simple warning. The solution here couldn't be simpler. The cuff must always be placed on a bare arm. Don't let a medical professional take it over your sleeve, no matter how busy they seem. Just ask for a moment to take off your jacket or roll up your sleeve. And when you do roll up a sleeve, make sure it's not bunched up tightly at the top of your arm, because that can act like a tourniquet and also skew the reading. Your best bet? Just wear a short sleeve shirt to your appointment. If you're finding this information surprising and maybe a little shocking, and you want to keep learning real, evidence-based ways to take control of your health, I would be so grateful if you consider subscribing. It really helps the channel out and you won't miss our future videos. Now let's talk about one of the most overlooked mistakes of all. Mistake number 4 is really a group of mistakes that all come down to one thing: not getting your body ready for the measurement. Your blood pressure isn't one fixed number. It's changing all the time based on what you're doing, your environment, and even what you're thinking. To get a true resting blood pressure, you have to be in a true state of rest. Rushing into a measurement will give you a rushed reading, not a resting one. Let's break these down. First, you must rest for at least 5 minutes in a quiet place before you hit that start button. If you've just run in from the parking lot or climbed a flight of stairs, your heart rate and blood pressure will be up. Skipping this 5-minute rest can inflate your reading by 10 to 20 points. Second, you have to be quiet during the measurement. That means no talking, not to the person next to you, and not on the phone. The act of talking and even just listening closely stimulates your nervous system and can raise your reading by a good 10 to 19 points. Be polite, but once the cuff starts to inflate, it's quiet time. Third, hold off on certain things for at least 30 minutes before your reading. This means no caffeine from coffee or tea, no nicotine from smoking or vaping, and no alcohol. These substances directly affect your blood pressure. Caffeine and nicotine, for instance, tighten your blood vessels, which makes your heart work harder and can raise your reading by 5 to 8 points. And fourth is a big one that most people don't know about: having a full bladder. When your bladder is full, it puts pressure on your organs and kicks your nervous system into a fight or flight mode. This can significantly increase your reading by anywhere from 10 to 15 points. Some studies have even shown an increase of over 30 points. The rule is simple: always use the restroom before you sit down for a measurement. So the solution is to create a simple pre-measurement ritual. Before you even touch the cuff, go to the bathroom. Then sit down in your chair, back supported, feet flat, in a quiet room. Set a timer for 5 minutes. During those 5 minutes, don't talk, don't scroll on your phone, just sit there and breathe. Only after that quiet period is over should you start the measurement, and stay still and silent until it's done. This ensures the number you see is your true resting blood pressure, which is the only one that really counts. Our final mistake is a two-parter: using a machine you can't trust, and trusting a single reading. This is all about your tools and your method. If you get this wrong, it doesn't matter how well you do everything else. First, the machine itself. Not all home blood pressure monitors are accurate. Many devices you can buy online or in a pharmacy have never been clinically validated, which means they haven't been tested against a medical gold standard. You could be following all the rules, but if your machine is off, your numbers won't be trustworthy. And this isn't just a problem at home. Even equipment in clinics can become inaccurate over time if it's not calibrated. So how do you know if your device is reliable? You need to use a validated monitor. The American Medical Association keeps an official list of these devices. You can find it by searching online for Validate BP. Before you buy a monitor, or to check the one you have, look it up on that list. If your device isn't on it, you can't be confident in the numbers it's giving you. The second part of this mistake is believing one single reading means anything definitive. Your blood pressure goes up and down all day long. A single measurement is just a snapshot. It could be high because you were stressed about an email, or just because of normal daily changes. This is the whole problem with white coat hypertension. The stress of the doctor's office causes a temporary spike. A doctor should never diagnose you with hypertension or change your medication based on just one reading. The solution is to gather good data. Here's what the experts recommend. Each time you measure, take 2 or 3 readings, waiting about 1 minute between them. Then toss out the first reading. It's often a little high because you're anticipating the squeeze, and average the second and third readings. That average is a much more stable and accurate value for that moment. Even better, you should track these averaged readings over time. The American Heart Association suggests measuring at the same times each day, like morning and evening, and keeping a log. This log, taken over a week or more, gives you and your doctor a true picture of what your blood pressure is really doing. It's this trended data that allows for smart, informed decisions about your health. So let's quickly recap the 5 critical mistakes. First, improper posture, like slouching, crossing your legs, or letting your arm hang down. Second, using the wrong-sized cuff. Third, measuring over your clothes. Fourth, not preparing for the reading by resting, staying quiet, or emptying your bladder. And fifth, trusting an unvalidated machine or relying on a single reading. Knowing this puts you in the driver's seat. You're no longer just passively getting a number, you're an active partner in your own health. By controlling for these 5 things, you are taking control of your health data and making sure the numbers are true. An accurate measurement is the foundation of good health decisions. It prevents the anxiety of a wrong diagnosis, helps avoid unnecessary medications, and empowers you to have a better, more data-driven conversation with your doctor. Your blood pressure is one of the most important signs of your long-term health, and you owe it to yourself to get it right. If this video helped you feel more in control of your health, please give it a thumbs up and subscribe for more content like this. And more importantly, share this video with a parent, a friend, or anyone you know who checks their blood pressure. You could save them from a lot of unnecessary worry. And finally, I'd love to hear from you in the comments below. Which of these 5 mistakes were you most surprised by? Thanks for watching, and here's to your health.